Hello and welcome. I'm your host, Britton Gray, Executive Director of the Global Domestic Engagement Department for Providence Health System. As a reminder, the information provided during this event is for informational purposes only. If you have a medical question, please reach out to your primary care or healthcare professional. Now let's begin. Tomorrow is Giving Tuesday, a day that encourages people to give back to causes they care about and to do good in their communities. As we enter the holiday season, we're excited to inspire listeners of today's event with new ways you might consider volunteering or making an impact in response to urgent needs across our communities. Joining me during this live event are Hannah McNutt, Community Engagement Liaison from Bloodworks Northwest, Brian Chandler, Director of Outreach from Union Gospel Mission, and Nathan Rogers, Mission Integration Manager from Providence. Hannah, Brian, and Nathan, I am so excited to connect with you today. Each of the organizations you represent serve a distinct and vital purpose in our communities. I'd love to open with each of you telling us about your organization or program, its location, who it serves, and its focus. Hannah, let's start with you.
Hi, thank you so much for having me. Yes, so I am a community engagement liaison from Bloodworks Northwest. We are the local, independent, community-based nonprofit organization for the Pacific Northwest. We serve about 90 local hospitals, and we provide blood to about 95% of the region. We have a center all the way up in Bellingham, and we expand all the way down into Oregon a little bit now. We did partner with the Lane Blood Center in Eugene, and we're happy to be here. And we not only support the community by offering blood supply for all of us, but we do have a lab and physicians that help with blood clotting diseases, and we have a lot of research that goes into our company as well. So thank you for having us.
Awesome. Thank you, Hannah. How about you, Brian?
Yeah, it's great to be here. Brian Chandler with UGM. We started 89 years ago out of a need to help individuals through a tough time of the Depression, get some help living on the street. And we are still doing that today. So we are helping men, women, and children who are suffering from some form of homelessness or mental health or addiction through our recovery programs, our shelters, our meal programs, with clothing, meeting needs, helping people get off the street and get the help that they need. So we're excited about our work, and we're excited to be a part of this. So thanks for the invite.
Thank you for your vital programming, Brian. Nathan, how about you?
Good morning, everyone. For me, it's morning. I'm in Alaska, and I'm Nathan Rogers, the manager of mission integration and spiritual care for Providence, Alaska Long-Term Care, which comprises 2 skilled nursing level facilities on one campus. We're the largest not-for-profit skilled nursing facility in the state, second largest Providence facility, and after the main hospital here. So we have a 50-bed transitional care center, which provides rehab recovery services to people coming out of the hospital, out of the acute care setting, but who aren't quite ready to transition back home yet. They're often with us for, on average, 1 to 3 months. And we have a 96-bed extended care facility, which serves people who need long-term nursing care. These residents live here for years. This is their home. Many of them die here. One of the highlights of the extended care facility is the setup. When it was built, they took every measure to elevate the dignity of the residents. So instead of one large rectangular facility with long hallways and sterile rooms and fluorescent lights, our residents each of them live in a 12-bed cottage set up more like a home, with a large living room and fireplace and dining room table where everyone can sit. There's an outdoor patio with a grill, and there's a kitchen with a cook there every day to personalize meals and preferences. The residents are encouraged to help decorate their space and plan activities. And there's all kinds of wonderful things on the campus, meeting spaces and a chapel and a gift shop and that sort of thing. And so my job here is to oversee the spiritual care services and then a lot of staff support to keep everybody in good spirits.
Amazing. I can't wait to hear more from each of you as we think about the incredible services and programming that you offer as we think about service and health of our communities. Hannah, I'd like to start with you. We've heard that throughout the pandemic, blood donations have dropped and that there's a national blood shortage. Is this something that you're seeing within BloodWorks, and what are you doing to address this?
Yes, that definitely is something that we're seeing at BloodWorks at the moment. We are kind of calling it the perfect storm, so to say. There's kind of two folds into why we're having a low inventory at the moment. One of the reasons, of course, is COVID-19. We have social distancing guidelines in place, much like everyone else at the moment, which means that we've had to drop the amount of appointments that we can offer per hour at our centers and at our pop-ups. We also are kind of in the middle of a severe staffing shortage at the moment. So with not having enough staff, phlebotomists, we are having to reduce hours at centers, not have our teams go out quite as often as they used to. Previously, we'd go out to the community, all these different spots once a day. And with the amount of staff that we have right now, we aren't able to do that. So we're a little bit more limited on what we can offer. The other part of it is that we are running an appointment only model at the moment, just to make sure we don't have a lot of bottlenecking of any sort. With appointment only, though, it's getting difficult. Appointments will fill up and then people will cancel last minute or won't show up. So those appointments that are made, it's very important to keep that appointment just so that we can ensure that we're having a full capacity blood drive or center for the day. The last thing that's kind of adding to this perfect storm is that we aren't able to go out to high schools like we used to. There's some schools that are allowing us to come out, but it's very limited. So not being able to be out at schools or colleges, anything like that, we are seeing a huge decrease in first-time donors. When you go out to a high school, those 16, 17-year-olds, 18-year-olds are very eager to get out of class and go donate blood. And we have a huge first-time donation rate because of that. Without us being out there, we're not having those first-time donors. So in order to address these concerns, we're focusing our attention on trying to bring in first-time donors and generate more awareness. We have multiple campaigns that we have been running. One of the campaigns was a Save More Lives campaign back in the summer, and we partnered with kind of some basketball players, I believe, some kind of famous, I don't know if you want to say influencers maybe in the world, to help kind of push out the word and bring awareness around it. We do have a Music's in Our Blood campaign that's running right now until the end of December, I believe. We have been partnered with Sub Pop Records and Starbucks and a few radio stations to help spread the word. There was a big giveaway that we just did with Macklemore, actually. He posted on his social media, I believe in his Instagram, and told people to go donate blood. And if they donated before November 28th, they would be entered in to win to see him in Cabo. So we're trying some different campaigns to just bring awareness around the need, target some different demographics. And right now it's that first-time donor, younger generation that we're really trying to bring in right now. So hopefully that answers your question.
Those are fantastic strategies at play, and you've definitely helped us to understand some of the challenges that organizations like BloodWorks Northwest are facing. Let's move on to hear from Nathan and more about the resident care side of things as we think about the needs. We've seen the pandemic have a great impact on how we provide care safely, especially to our most vulnerable. And I'm sure that daily life in the long-term care setting has changed. Can you talk, Nathan, a little bit about how the needs of the population you serve has changed and what your team is doing to help?
Thanks. That's a great question. And as I thought about this leading up to today, I thought, how am I going to answer this in a reasonable amount of time? And I think the way to say it is that the needs necessarily haven't changed, but the challenges have become even greater. It's well known in the long-term care sector that the three greatest challenges in long-term care for the residents are loneliness, helplessness, and boredom. And if you can imagine, what the pandemic did is increase especially the sense of loneliness and helplessness amongst our residents. And the things that have been done are sort of this laundry list of creativity from our families of our residents to, we have activities coordinators here, staff in other departments coming up with all sorts of things. One of the great challenges has been our residents pre-pandemic getting out and about off campus. It was normal, but it was also for a resident in long-term care, you might go out once a week, sometimes twice, many of them much less than that. And so suddenly when getting out and off campus became very, very rare, certain medical needs would bring them off campus, but very few other things. That sense of isolation that comes from loneliness increased in a dramatic way. And so staff here, and I'm sure at nursing homes and assisted livings across the country, have come up with all kinds of ways to continue to try to provide, again, dignity and a meaningful experience of life. That's really what it comes down to for our residents, who many of them can't get out of bed without the assistance of another person. And those who can get out of bed were often told, because of COVID precautions, that they weren't allowed, for this reason or that, to leave the cottage or the campus, or because of staff shortages. It's no secret that healthcare has a staff shortage, but from what I understand, the world has a staff shortage right now. So one of the phrases we've circulated is, the entire world is short-staffed, so be kind to those who actually showed up. So things that have been done is, one of the things I wanted to share first off, so I don't forget, is Providence has launched a campaign called Messages of Hope, where they're engaging all of the caregivers, this large healthcare system, 120,000 employees, asking people to write messages of hope. So write a card, write a letter, and it's from a stranger to a stranger, and you send it to a facility of your choice, skilled nursing or assisted living, and include a uplifting story. Tell them about yourself. Include a quote that brings you hope, happiness, or joy, and send it to a stranger. And so we've been the recipients of a number of these messages of hope, and I just have a few here to share. So these are envelopes, each one individually sealed, and we give them to our chaplains to pass out to residents. And we say, hey, I don't know who sent this, but somebody wrote this expecting that you'll read it and hoping that it's going to lift your day, lift your spirits. We've passed out maybe 100 of these so far, and have received wonderful feedback from our residents. Residents who can't open them, we open them with them. We read them for residents who can't read them. We've gotten a few where the letter kind of had a preamble statement that said, I know that some people won't be able to read or maybe even comprehend because of things like dementia. So here's a picture that I drew, or me and my child painted together. And it's just lovely. Residents have put a few of these up on the walls. They've said, we had one resident cry at just the notion that somebody that they didn't know was thinking of them. And one of the fun stories is when I spoke with one of our nurses in the cottage, she just shared how it warmed her heart because she was going above and beyond, going the extra mile in her job to care for all of her residents. And it warmed her heart to see that somebody else was trying to care for her residents as well. So it gave her an extra boost as well. So these messages of hope have been kind of a real shot in the arm for passing around kind of goodness, because the pandemic has created all of this sense of loss. And that's often what gets talked about. What have we lost? What are we not doing anymore? So here's one thing that we are doing. And I'm going to stop there so I don't take up too much time, but I hope that answers your question.
Well, that is a very powerful initiative, and so amazing to hear about how connection is being cultivated and established through challenging times. I'm sure that some of the challenges highlighted layer in with some of the experiences that, Brian, you are having at Union Gospel Mission. We've seen that the pandemic has also exacerbated existing challenges with our communities facing homelessness, individuals struggling with housing affordability, mental health, behavioral health, and more. Can you tell us a little bit about how the pandemic has impacted our neighbors that you serve, and have you seen their needs change? How is UGM working to adapt to best meet these challenges?
Yeah, I mean, being homeless has its own challenges, of course, on its own, and you throw the pandemic in there, and it just it's kind of flipped it upside down a little bit. Immediately when the pandemic hit, a number of services and their operations shut down, and what the result of that was an increase, obviously, of people that were kind of pushed out onto the street. And so the numbers have increased. Not just that, but we went through that whole jobs and people losing jobs and losing their housing because they lost their job, and then they end up on the street. And so that increased that number as well. And so a lot of the folks that it impacted were people that were homeless for the very first time in their life. And when we think of homeless, we think the man that has the long beard and stands at the street corner with a sign. But these are families. These are people that are scared to death and not knowing what to do or next. They've never been in a situation. Trying to find a job during that time period was tough. Still is tough in some cases for some of the individuals. So it's been a big impact. Also, the medical side of it. The individuals that were left on the street were in some cases more accessible to disease and COVID and other things, and weren't able to get the treatment that they needed because of lack of employment, which means lack of insurance and so on and so forth. So we're unable to get the services that they need as well. So we kind of rallied together. UGM did not stop going out on the street. There was never a moment where we stopped. Our outreach teams became very creative and innovative in how we approached. Obviously, it changed the way that we do things, which will be lasting for us, which was something good that's come out of this. But we've increased our routes. We've increased our partnerships as well. So many of the individuals who were closing services, we invited them, hey, what it looked like if you came out with us and still maybe offered some of those services, medical services, dental, behavioral health, some of those others. So we've increased partnerships and invitations for people. We've tried. Volunteers have been tough during this time as well. And so we're trying to increase that piece because it's so vital to what we do. Everything encompasses, even kind of what Nathan was talking about. It encompasses relationship. Everything that we do is because of relationship. People change because of relationship. People are able to face their fears because of relationships. And so that's what we do. We're out on the street and we're trying to build relationships with individuals, trying to make them let them know that we care about them and that there is a path out. And that gives the hope, that gives the hope that they need to be able to carry on. And services are starting to open back up. Of course, the numbers have declined because, spacing and different things. So we've had to, again, be more creative in our approaches with our, we changed our women and children shelter. We increased the beds there and our recovery programs and getting ready to even do a new enhanced shelter model where we're able to really offer more services to individuals who are coming in off the street. And then, making sure that people get the food and the clothing. And right now, we've been through this rainy season, which has been extremely tough. So making sure that people are still getting what they need while they're waiting to get services. And unfortunately, many of the services that were once available prior to COVID aren't available still at this time. So our shower trailer that we take out has increased the number of places that we're going to allow people to get showers and to help in that bring some of that dignity and hope through that shower trailer as well. So we're doing what we can to get out on the street night and day and partnering with a lot of the different cities throughout King County to work with the services that are already available to and inviting them out as well. And we've seen some great results through this time as well through COVID and getting people the help that they need. So that's kind of how we are facing this this pandemic.
Thank you, Brian. In listening to each of you speak, I think about your work really at that nexus of courage and compassion. And there's work that each of you carry, communities that you catalyze for good. And I'm interested in thinking about our theme for today, what some of the ways are that we as community members can bring a service and giving mindset to Giving Tuesday, of course, with our financial contributions for organizations like the ones you represent, but also with our hearts and hands. How can we best serve your mission and the call that you're working to fulfill as we think about the urgencies that we face right now? And I'll pitch this to you, Hannah, first, as we think about some things that might be in view for BloodWorks Northwest.
Yeah, thank you. So, of course, the first thing that would come to my mind would be, of course, to donate blood. Our community cannot live without it. You know, a lot of times people think that victims of a trauma accident, say a car accident, are the first and only people to get a blood transfusion. But at the end of it, it's really those cancer and leukemia patients that receive multiple donations of blood transfusions for their treatments. The other way that, of course, you are able to help is just help spread the word. You know, is there a church that you attend that would be willing to host a blood drive? Is there a group that you're a part of, maybe the Chamber of Commerce, or is there a student in your life that is looking for a scholarship? We do offer scholarships for students. So there's lots of different ways that you can think about supporting BloodWorks Northwest in your local community. Of course, like I said, donating blood is a great one, but with limited appointments at the moment, if you're unable to find an appointment, just think about some other groups that you're a part of and help spread the word, educate donors that it's not just those trauma victims that receive blood. December 18th, really quick before I forget, is the Washington and Oregon State Blood Donor Day. It is the second annual anniversary of this. It marks the train derailment that happened a few years ago on the Amtrak train. So we are asking people to strongly consider donating blood in December if you are able to. We have a virtual blood drive happening. So if you go in and you donate, mention the code HOPE, and your impact will be counted towards this Washington, Oregon State Blood Donor Day. So yeah, there's lots of ways that you can help. Just kind of spread the word, let people know that BloodWorks Northwest is the local nonprofit blood donation company, and that is the best that we can ask for.
Thank you, Hannah. Nathan, how about you as we think about residential care facilities and particularly the challenges of isolation?
Right. What a great question. And I'll try to keep it short, but a quick brainstorm is, you know, if you wanted to join in on the idea of the messages of hope, you know, you could certainly, anyone, get some stationery and some envelopes. Call your local facility. I'm not here asking you to do something for us. I'm in Anchorage, Alaska, and there's people all over, I'm sure, listening to this. Call your local facility, or maybe you have a family member or a church member or somebody you know in a facility, and ask them, what do you need? How many residents do you have? And if they have 50 residents, maybe you and your group or your kids, you come up with 50 cards that you want to send. People put together goodie bags and send them. Just send some candy to the staff. You could send, it needs to be appropriately packaged and everything, but you could send candy or food to the residents. But I really think that calling your facility and saying, hey, what do you need? What could lift the spirits just a little bit? Hannah's ahead of me in the idea of, if you're a part of a church, see if your church wants to do something as a group that maybe you can't do on your own. And then there's the idea of visiting. Again, if you do know somebody, a family member or a friend or a church member who lives in a facility of any kind, go visit. CMS has made it real clear that visitation is open. In our facility, visitors can visit anytime. We do a COVID screening. We'll give you PPE and a mask and shield, all those appropriate things. But if you visit somebody in a facility, it's a small part of your day, but it's probably the biggest part of their day. And if you visit every week, or if your church group decides, hey, we're going to go every month on this Sunday or this Saturday, what an impact you can make by creating some of those connections, especially long-term connections. So those are just a few thoughts.
Thank you, Brian. Those are fantastic and inspiring ideas. And excuse me, Nathan, thank you for those ideas. And lastly, Brian, thinking about UGM, what would be your thoughts in terms of how you would call us as community members to walk alongside our neighbors experiencing homelessness and walk alongside UGM and organizations like UGM across our communities?
Yeah, you bet. You know, Providence has been good about this in the past, getting a group of people together to, we hand out foods. We make peanut butter and jelly sandwiches are the favorite on the street. And of course, as I mentioned, hygiene is such a huge need right now. So not a lot of places available to get something as simple as a toothbrush and toothpaste. So putting together some hygiene packs And then we're embarking upon some cold weather, and this is tough for individuals who are sleeping out on the street. So, coats and gloves and hats and scarves and anything of that nature. And all of these mentioned are really easy to obtain through our website. So ugm.org. There's actually a place on there where you can see the kits if you want to make the kits yourself, or we have an Amazon list where you can actually purchase some of those. But it's as easy as just doing a clothing drive or something of that nature right there where you're at, in your office or at home or with your church or with your family or something of that nature. And also the locations to drop those off are also on our website to be able to meet those needs on the street. And then, of course, volunteering, coming out with our teams either during the day or the night. You can sign up to volunteer with us and come out with us and build some relationships and give some hope. And it's always a big impact for those people. And for us, it encourages our hearts too, to have other people out there. We kind of get tired of seeing the same old faces all the time. So it'd be kind of nice to have some new faces and build some new friendships and relationships for ourselves as well. So.
Thank you, Brian. And each of you has really shared, I think, some fantastic ways that we can dive in as individuals, as families, or as a community circle to make a difference. And sometimes I think that hearing about the need is one thing that activates us for service or volunteerism, but hearing about the impact takes us even further. And as we think about coming almost to a close within this conversation, I'd love to hear if there are any stories that come to mind about the impact of your organizations. And knowing we have a limited time, we might just do one or two. But Hannah, I'm curious if you'd share thinking about the impact of blood donations.
Oh, of course. Yeah, we have a lot of patient stories or patients that reach out to us and say, your blood donation went to my daughter or someone of that sort. One of the ones that sticks out the most to me is when I first got hired on, I worked with a little girl. Her name was Hannah. And when she was a few months old, she needed to have a heart transplant. She had a tumor on her heart, and she ended up receiving 59 units of blood as just a little baby. Because of those donations and what was on the shelf at that time, she was able to have a successful surgery, get everything she needed, and she is now, I believe, in second or third grade at this time. She's gone to Disneyland a couple times, and she's a thriving little girl. So without those blood donors who donated just in the act of willing to give, they didn't know who it was going to go to. They ended up saving her life and many other lives similar to that.
That is awesome. I think that definitely gives us a sense of the impact that blood can make. And Nathan, I feel like we got to hear a little bit about some of the impact within the long-term care facilities and the impact of the messages of hope. So we'll carry that with us as we think about the difference that kind of work can make in building connection and community. And maybe we can close with you, Brian, in a brief story thinking about the impact that UGM is having within the community.
Yeah, absolutely. The other day I got a phone call at 3:30 in the morning, and I looked at my phone at the call, and it was 32 degrees outside. And the call was about a mom and her 4 kids that were living in a pickup truck. It was due to some domestic violence situation, and she was living in her pickup truck, first time ever in her life being homeless with 4 kids and a puppy dog in a pickup truck. But because we were able to, we are financed by donors. We're financed by individuals. And because of that, we're able to have the staffing that's able to respond to that immediately. And we were able to do that. We were able to get them into some housing and get them connected to services and right before the holidays. So they were appreciative of that, being able to get them in, but it meant so much to us and to our team to see. Nothing warms your heart. And I'm sure Hannah would agree with this, when you see a child who gets the help that they need to be able to push forward in their life. Warms your heart. So
thank you to each of you for all that you've shared. Brian, Nathan, Hannah, thank you for joining this conversation today, and thank you to everyone who chose to listen in and to share your comments as well. I am sure that the 3 of you have inspired all listening today. You certainly inspired me about how we can deepen our impact, solidarity, and service as we think about the urgencies of today. To learn more about our initiatives or programs and services, ways to give, or if folks listening are looking for help or medical advice, you can visit providence.org, and also make sure to follow us on social media at Providence on Twitter and at Providence Health System on LinkedIn, Facebook, and Instagram. May this season of giving be one in which we each find new ways to give, to serve, and to inspire community. Wishing everyone a wonderful afternoon.